Very interesting. My book, Hydrogen Medicine, was just going to the printer. And last night, I had the inspiration to write a chapter about hydrogen and lung cancer. So I'm going to publish a very complete essay in the book, if they let me submit it at the last moment. A document in my newsletter tomorrow about lung cancer and using hydrogen and oxygen gas and glutathione, sodium bicarbonate, iodine, magnesium, nebulizing these substances. The National Foundation for Cancer Research says, and I quote, "The lack of other treatment options greatly contributes to lung cancer's shocking death toll." In medicine in general, and in oncology for sure, if they don't know alternative treatment, it doesn't exist. This is the description of arrogance in medicine that kills a lot of people. Obviously, other treatments exist. Now, hydrogen inhalation makes perfect sense for lung cancer because the hydrogen is going directly into the lungs and the increasing oxygen. I'm not saying this off the top of my head. When you read the essay that goes with this video, you'll see different research teams, all from China, doing basic research into using hydrogen for cancer treatment, and it is proving to be effective. Hydrogen is proving itself to be effective in ICU departments when people are dying of different causes. It's a wind that blows people away from death's door, even if they're standing right in it. Lung cancer patients, hydrogen inhalation is ideal because, depending on the stage, if you're in a very late stage and in bed, you could just turn on the hydrogen and oxygen inhalation machine and run it 24/7 and constantly have a wind that's pushing back against the cancer, against death. I personally sleep all night on hydrogen gas, and it's bringing me back, years. I look better than I did 10 years ago and feel better. But we're talking about cancer. Nebulization, specifically of sodium bicarbonate and glutathione together. Sodium bicarbonate by itself, every cancer patient should be using it for many, many reasons that I can't even begin to list right now. But nebulization of bicarbonate right into the lungs, again, is ideal because you're directly affecting the cells, you're directly bringing the medicine, bicarbonate, to the cancer cells, to tumors, which will have a dramatic effect. Again, for many reasons, which I have published about. You'll see the links to the different things I published about that, about using bicarbonate for cancer in general, for every form of cancer. Cancer just doesn't do as well under alkaline, high oxygen, high cell voltage conditions, which go together with increasing alkalinity. Glutathione is a great substance to combine with bicarbonate, and there's a product that you can buy that combines the bicarbonate and glutathione specifically for nebulization. Medicine doesn't get any better. And even if you do chemotherapy, which I don't like the idea of toxic chemotherapy, since there are alternative forms of chemotherapy that are not toxic. But even if you do chemotherapy, hydrogen gas mixed with oxygen, bicarbonate, glutathione are going to mitigate some of the, or most even, of the side effects of the chemotherapy and help the chemotherapy work better. This is especially true for sodium bicarbonate because it makes the cancer cells more vulnerable to the chemotherapy. Add iodine. You can nebulize iodine. Iodine is very different with nebulization because you put the iodine in the nebulizer and turn the machine on, and because it vaporizes very easily, it just goes in one shot into the lungs. So you don't want to dose it too high and shock the body, because you get a good dose, but it's very quick. It's very quick. Magnesium chloride is another, specifically using magnesium oil, pure magnesium oil from the Zichtine Sea. You can nebulize that. And what you're doing is, with the iodine, with the glutathione, with the magnesium, you're bringing health energy to the lungs. You're stimulating the healthy cells to resist the cancer cells, and increasing the overall strength of the body, the immune system. All of these things make excellent ideas. Also, with lung cancer, advanced lung cancer is often accompanied by bacterial infections, fungus infections. Often doctors confuse fungus with cancer and cancer with fungus. The bicarbonate and the iodine are both very strong antifungal, antibacterial agents. Magnesium chloride as well, especially for bacteria. So what I'm proposing are treatments for lung cancer which kills, no matter how they present it, easily over half people die of their lung cancer. It's a devastating disease. It makes sense, it's crazy to think that for the rest of eternity, half the people with lung cancer are going to die. The human race, we have our fallacies, but we're not that stupid. There are solutions that people can do at home without their doctor, because doctors don't know anything about these things, and they don't want to know. But you should know. For the sake of yourself, if you have lung cancer, or for your loved ones, do things that make sense, that have scientific backing, because nothing I've said today does not have scientific backing. So think twice when you just surrender to your oncologist and odds are stacked against you with lung cancer. If you enjoy this video and find it interesting, leave a comment in the bottom. Go to my site, drsircus.com. Sign up for my newsletter. If you're not subscribed to my channel, sign up right now so you get future notifications of my videos, and make sure to press the like button.